Hi, I'm Dr. Tim O'Carrigan, orthopaedic surgeon specialising in foot and ankle surgery and limb reconstruction. And today I'm going to talk about complications from ankle replacement. We all know that ankle replacement is a successful operation aiming to correct deformity, relieve pain and preserve movement for patients. But like any surgery, it has a potential for complications, and those complications sometimes can be very, very serious. With the surgery, we have to make an incision, and therefore wound healing is a potential problem from ankle replacements. We try to minimise those risks with meticulous soft tissue handling, meticulous wound closure, and we keep a very close eye on the wound after the operation with the review at 1 week and 2 weeks. And if there are problems developing, we can manage them early. But in a worst case scenario, that wound healing problem can lead to deep infection. And deep infection with an ankle replacement is a disastrous complication, because often to eradicate the infection, we need to remove the ankle replacement, debride it, put in a cement spacer, and then come back and do a second stage operation. And in an even worse case scenario, deep infection can lead to the need for amputation, which can complicate ankle replacement. Fortunately, that's a very rare complication, but it can occur. When you do surgery, there is alterations to the circulation of the leg, and there is a risk of getting a blood clot in the leg. Now, with surgery, you always have to walk this line between bleeding and clotting, because we don't want a lot of bleeding at the operation site, but we do want clotting at the operation site. If we have clotting outside of the operation in the veins in your leg, that's called a DVT, deep venous thrombosis. And if that's unrecognised and untreated, that can break off and travel up to the lung, causing a pulmonary embolus. That can make you very sick, and in a worst case scenario, you can die from it. We know that the foot and ankle is a very sensate part of the body. There's many nerves, and so during the surgical process, we're always looking for nerves, always being careful about protecting them. But they have a tremendous habit of being right where we want to be to do what we need to do for the surgery. And so mobilising nerves, retracting them, protecting them is a standard part of the procedure. There is a risk of nerve injury, and that can lead to some numbness around the wound. Often patients can adjust to that, and sometimes with time that numbness can actually resolve. In some cases, a nerve injury can lead to a thing called a neuroma, which is a thickening or scarring in the nerve, and that can lead to neuropathic pain. Now, neuropathic pain is nerve type pain. That's usually burning, can be electric shock type sensations. It's very unpleasant. It's very difficult for patients to deal with, and it's actually quite difficult to treat as well. We don't have many good medications to deal with that type of pain. And so we're very careful to try to avoid nerve injuries with ankle replacement. There is also the potential for blood vessel injury. There is an artery at the front of the ankle that we mobilise as part of the approach to the ankle replacement. The main artery to the foot actually passes behind the ankle, behind the inside bone of your ankle, called the medial malleolus. Now, we don't see that artery during the operation, but it is at the back, and we are operating around the back of the ankle. And so we're very aware of this, and with an injury to that artery, then that could lead to a critical loss of circulation to your foot and ankle, which is obviously a potentially limb-threatening problem. Fortunately, that is extremely rare. There is a risk of blood supply problems to the ankle bone called the talus, and that can lead to a thing called avascular necrosis of the talus. This is a rare complication, and it's a very big problem if it does occur, because it can lead to collapse of the talus, loosening of the component, and that can lead to revision surgery being required. In the past, because of that loss of talus bone, that has had to be salvaged with a fusion of the ankle, which has been technically difficult because of that bone loss, and has a very high dissatisfaction rate and very high failure rate. Fortunately, with newer technology now, we do have the potential for a metal replacement of the talus called a custom talus component, And that's something that through our unit here, we are unique in Australia in being able to offer that solution to patients. There is a risk of stiffness in the ankle. Ankle arthritis is often characterised by stiffness, and because of previous trauma, operation, scarring and thickening, stiffening of the soft tissue envelope around the ankle, then there can be a lot of stiffness associated with ankle arthritis. With the insertion of the ankle replacement, we're careful to remove extra bone that might be causing impingement and blocking movement. Soft tissue balancing, bony alignment, correction of deformity, all of these things help with restoring our range of motion of the ankle. And we do get you to come out of the boot and start your ankle moving as soon as our wounds are healed at the 2-week mark. The ankle replacement, as we know, is made up of 3 components. There's a plate on the tibia, there's a cap on the talus. They are uncemented, meaning that there's a ingrowth surface for bone to grow onto those components to give it long-term biological fixation. To give the bone an opportunity to achieve that, that's why we keep the patient non-weight bearing for 6 weeks and in a boot for a total of 3 months to allow a controlled environment for that process to occur. Sometimes the component, the bone does not grow onto the component fully or doesn't grow onto it at all, and that can lead to a failure to integrate, and that can lead to loosening and a cause of pain and revision. Fortunately, that's a very, very rare complication. The other problem that can occur with ankle replacements is cysts. Over time, cysts can develop around the ankle replacement in the shin bone, the tibia, or the talus. And if those cysts get large enough, they can lead to surgery being required in the form of debridement, cleaning it out and bone grafting it, or if they get very large and lead to component loosening, then the need for revision surgery. Cysts have been more of a problem in previous ankle replacements, particularly ankle replacements with a mobile bearing, where the bearing is not fixed to the tibial component. We've found with the more modern ankle replacements that we're putting in, the better fixation, better insertion techniques and more complete correction of alignment, then those cysts are of rare complication and tend to be smaller and less of a problem. So range of motion and restoring that range of motion is important, but in some patients, the scarring, stiffness of that tissue around the ankle does prevent them getting a very mobile ankle. Despite that, patients that still have a relatively stiff ankle after an ankle replacement are often still quite happy because they have the pain relief. And even with a small amount of movement, much less than a normal ankle, you can still walk well if you don't have pain and your foot and ankle is in a functional position. Incomplete pain relief is a risk for any surgery. One of the primary goals of ankle replacement is to relieve pain, preserve movement, correct deformity, and it is very successful at doing that. But some patients can have some ongoing pain with the ankle replacement. It's often nowhere near as bad as their arthritis pain was before, and sometimes we can find the source of that pain and correct it. It can be caused by some residual impingement around the ankle. It can also be caused by arthritis in other joints around the ankle. So arthritis can affect the ankle joint, it can also affect other joints such as the subtalar joint, talonavicular joint, different joints around the foot and ankle. And if they are arthritic as well, they can contribute to some ongoing pain. It's not uncommon when patients have an ankle replacement for them to have some arthritis changes on x-ray in these other joints, but with the insertion of the ankle replacement and preservation of movement, those joints are often not symptomatic. But there is a potential for them to cause some pain, and that may involve further surgery to optimise that situation. Overall, ankle replacement is a very successful operation. It's not a risk-free process, and there are potential complications that can occur, and in the worst case scenario they can be limb or life threatening. But we're aware of these risks. We take every chance, every possibility or opportunity to reduce those risks and try to achieve the outcome that you want and that we want for you.